I feel ashamed that I'm allowing patients to be treated in this way. It's like it's normal, and it's not normal. Patients are dying in corridors, and we're just watching people die.
In recent months, hundreds of people have sent us their stories and videos of an NHS struggling to cope. Hospital walkways, cupboards and waiting rooms turned into makeshift wards. Just this week, footage shared with us shows elderly and vulnerable patients who deserve better than this. So we've been investigating so-called corridor care in search of the reasons and the risks.
Are you ready?
Nope.
Since 75-year-old Bernard had a stroke, he needs round-the-clock care. But his family were horrified when he was taken into Royal Preston Hospital with sepsis and left in a corridor for 3 days.
It was like carnage. There were people everywhere. There was one man shouting for help. The staff were running up and down. There was no privacy at all.
How did it make you feel seeing your dad being treated in that way?
Upset, angry, a whole roll of emotions really, because he's a person. He's a person. He's my dad. He's not just a number. We were in tears most of the time. We just wanted answers. We just wanted him to get into a bed and get better.
Bernard is partially sighted and can't walk without help. Staff left food next to him, but he couldn't see it.
He didn't know where he was when he was on that corridor. He was just talking to the wall because he couldn't see. And he ended up with severe burns because of sitting in his own urine.
It happened last summer, not the usual busy winter months. How did it make you feel when you spent those 3 days on that corridor?
Horrible. They need more nurses. Yeah.
And more beds?
More beds, definitely.
How would you feel about having to go into hospital again?
No thank you.
What you don't see in all of the shocking footage we've been sent of corridor care is all of the patients on hospital wards who don't need to be there. Much of the backlog in our hospitals is caused by delayed discharges. Patients who are medically fit to leave but can't, often because of a lack of social care. Analysis by the Royal College of Emergency Medicine, shared exclusively with ITV News, shows that last year there were almost 13,000 delayed discharges every day in England. That's the worst on record. In fact, there were just 15 days when there were more patients discharged than there were delayed leaving. And it's not just a winter problem. We've learned that last summer there were almost 5,000 deaths in England associated with long A&E waits. One A&E staff member spoke to us anonymously just after they'd finished a shift.
Today was just so bad. It's just chaotic, you know. Today I've walked through A&E and there's just patients upon patients on oxygen in the corridors. It's actually embarrassing to work for the NHS. It's really embarrassing. And it's heartbreaking, it's depressing. I feel ashamed that I'm allowing patients to be treated in this way. It's like it's normal, and it's not normal. Patients are dying in corridors, and we're just watching people die.
The Royal College of Emergency Medicine says there needs to be more beds and fewer delays discharging patients.
There is absolutely rock-solid evidence that long waits in emergency departments are associated with an increased risk of dying. And that's what really worries us more than anything.
How does it feel for you as an emergency department doctor, seeing all that play out in real time, knowing that there's a risk to people's health?
The last 2 shifts I've worked in my emergency department, I've had very senior nurses in tears at the state of what's going on. And at times I feel like crying too. And why do I feel that? Well, I feel sorry for the patients, and I also know that I could do a really good job for our patients, and we as a team could do a really good job for our patients. But it's ever so hard to do that when our department is so full.
The sincere apology for any distress.
Royal Preston Hospital has said sorry to Bernard and his family. The government told us corridor care is undignified and it's determined to fix the mess it inherited. But for some, that pledge comes too late.
This is going to be the worst experience of my life, ever. It just makes you feel inhuman.
A couple of weeks ago, we spoke to Tommy Martin, who spent 4 days in hospital corridors, even his 60th birthday.
Sadly, his family have told us he died this week. They are devastated, not least because some of his precious final days were spent like this. A much-loved dad and granddad. Rebecca Barry, ITV News.